Arizona Science is supported by Research Corporation for Science Advancement.
For Arizona Public Media, I'm Leslie Tolbert, Regents Professor Emerita in Neuroscience at the University of Arizona, and this is Arizona Science. Our guest today is Roberta Brinton, Professor in Pharmacology and Neurology and Neuroscience, and Founding Director of UA's Center for Innovation in Brain Science. Robbie's a leader in the neuroscience of how our brains change as we age. Thank you for joining us today.
Well, thank you, Leslie, for having me.
You recently spoke with us about how our brains change as we get older, and you told us there are differences between the way women's brains and men's brains age. And one difference is that women are more susceptible to Alzheimer's disease as we get older. Today, tell us about the work you're doing that is about trying to reduce the risk of Alzheimer's disease for women. It's very exciting.
We're very excited to be conducting this research at the University of Arizona. And what we're really focused on is not when women or men are diagnosed with the disease, but decades earlier when the start of Alzheimer's disease can begin. And for women, that can actually occur during this midlife transition of the menopause. And that menopausal transition is a transition of the brain. We think of it as, and it is, a reproductive transition, but that reproductive transition is actually controlled by the brain.
So men's and women's brains age differently.
They do age differently, unless men develop prostate cancer. And then men begin to look like a woman's risk for Alzheimer's disease.
That's just amazing. So how are you dealing with trying to postpone or eradicate this impending Alzheimer's predicament?
So one of the interventions that has been shown to be quite effective in reducing the risk of Alzheimer's disease is menopausal hormone therapy. And there's a lot of controversy around hormone therapy during the menopause. The time for women, if they're considering hormone therapy, is during that period of time when women experience menopausal symptoms, like having what's called a hot flash, or depressive disorder, or autoimmune difficulties, or memory or cognitive deficits typically referred to as brain fog. And brain fog is an interesting term for what happens to the brain when it's undergoing inflammation in the brain. That brain fog experience is very typical of when people have an inflammatory condition.
And does estrogen affect whether this inflammatory condition happens?
Yeah, so I call estrogen the queen of Darwin. She has left nothing to chance. So estrogen promotes the generation of neural circuits, those circuits in the brain required for learning new information and complex information. You don't need estrogen for simple things. What you need estrogen for are complex things.
Tell us, how does this affect hot flashes?
So we're very excited. We're conducting our second clinical trial. We've established that phytoserum is safe, and we have early indicators of efficacy from our first clinical trial of phytoserum that we conducted a number of years ago and have published in peer-reviewed journals.
That sounds really exciting. Well, thanks very much, Robbie, for giving us this update on your very exciting work. At least half the population has a very personal interest in the work that you're doing. Dr. Roberta Brinton is a leading expert in the neuroscience of memory and aging. You can listen to this and all Arizona Science conversations at azpm.org/Arizona Science. I'm Leslie Tolbert.
Thank you to Research Corporation for Science Advancement for their support of Arizona Science.